Most of the time, headaches are a minor nuisance, but for some of us, the pain can be debilitating and cause for concern. Joining us now to discuss is Dr. Fernando Santos with the Orlando Health Cancer Institute. Welcome. Thanks for being here.
Thanks for inviting me.
Okay, so it is not just all in our head. Headaches can be really painful. Let's talk about some of the more common causes of headaches first. So here in Central Florida, the allergies can be really bad on people. That puts tension on your sinuses and then you get a headache. What are some of the other common causes? Another
common cause here in Central Florida is dehydration. As you know, it's very hot and warm and humid, so it's really easy to dehydrate, especially the older population above 60, but virtually any other disease can be accompanied by headaches, and also headaches can be caused by no specific reason. That's what we call idiopathic headaches. You just have a headache just because.
Communicating pain is kind of a difficult thing because everyone feels it differently, right? So how do you interact with your patients to really try to get a gauge on what kind of pain and how much pain they're feeling with a headache?
If the headache starts and it subsides, is gone after a few hours or after Tylenol or ibuprofen, it's something that shouldn't be taken too seriously. But if the headaches start and they're just not going away, or they're lasting longer, or they're related to nausea, vomiting, that's when you should really contact your primary care provider. That's the best way to first get checked in.
The worst news, that most of us would ever hear is that you have a brain tumor, but just because you have a brain tumor, it doesn't mean that it's cancerous. So what are the different types of tumors? If they're non-cancerous, do they still need to be treated?
So thankfully, the vast majority of the brain tumors or the intracranial tumors, they are benign. And that's very important to emphasize because usually these tumors can be followed with MRIs every so often, and they don't require treatment like radiation or surgery or chemotherapy. Now, if you're diagnosed with brain cancer or a tumor that may become cancer in the future, then that's when you see me and we develop a personalized treatment with radiation, surgery, chemotherapies. But I believe that the most important thing for our audience at home is that if you think you have a brain tumor because you're having a headache, most likely you're wrong, and you're thankfully wrong because brain tumors are not the most common cause of headaches.
Right, we tend to kind of go to the worst place first, right? So take comfort in the fact that most people, you're not going to have a brain tumor just because you have a headache. And if you would like more information, you can visit orlandohealth.com/cancer.